Today we are going to talk about redistribution phenomenon of drug. Redistribution of phenomenon of drug is seen with highly lipid soluble drugs. But before that, we will discuss what is meant by distribution of drugs. Whenever we say distribution of drugs means it's a pharmacokinetic property. Distribution is a pharmacokinetic property. That means it's a movement of drug from systemic circulation to the various tissues in the body. What is by distribution? It's a movement of drug from systemic circulation to the various body tissues, and ultimately it will reach to the site of action. Ultimately it reaches to the site of action where we needed or where we required. So drug will reach to the first to the highly perfused organ like heart, brain, kidney, liver, then to the moderately perfused organs like skin and muscle, and lastly to the poorly perfused organs like adipose tissue or fat. This is the hierarchy of the body tissues where the drug will reach. Drug will reach first to the highly perfused or highly vascularized organ like heart, brain, kidney, liver, then to the moderately perfused or moderately vascularized organ like skin and muscle, and lastly to the adipose tissue or fat because it is less perfused or poorly perfused. Okay, so this is the distribution of drugs. It's a movement of drug from systemic circulation to the various tissues, and ultimately the drug will reach to the site of action. So we can say what is distribution of drug? Movement of drug from systemic circulation to the site of action. Okay. Now the phenomenon redistribution, what is mean by that? Movement of drug from specific tissues, movement of drug from specific tissue to the plasma and then to the less perfused organ like adipose tissue and muscle. What they want to say? Movement of drug from specific tissue to the plasma and then to the less perfused organs like adipose tissue and muscle. This is what is redistribution of drug. Now we'll understand better. This is the drug which, for example, we'll take thiopentone, which is a ultra short acting barbiturate. And where we use this thiopentone is used for the induction of anesthesia, right? For the development of anesthesia. So drug, first of all, it will get absorbed. When the thiopentone is given intravenously, the drug will get absorbed into the systemic circulation. Systemic circulation means blood. Okay. Now the site of action of the drug is brain. Site of action of drug is brain. So it will get distributed to the brain, which is highly perfused organ. That is the distribution. Drug will get distributed to the brain. Means movement of drug from systemic circulation to the site of action. From systemic circulation, from blood to the brain. From systemic circulation to the brain. This is distribution. Now, what they are saying, what is meant by redistribution? Movement of drug from specific tissue. Specific tissue is the brain. To the plasma. Again, it will get redistributed to the plasma. From where? From brain to plasma. That is redistribution. And then to the less perfused organs like adipose tissue and muscle. That is the redistribution phenomenon. We'll see one more time. What is distribution? Distribution means from blood to brain. And what is redistribution? Redistribution means from brain to again blood. From brain to plasma or brain to blood. And from the plasma or blood, again it will get redistributed to the less vascularized organ like adipose tissue and muscle. That is what is called as redistribution phenomenon. Okay. Redistribution phenomenon of drugs is seen with only highly lipid soluble drugs. It is seen with not all drugs, those who are highly lipid soluble drugs, and for example thiopentone sodium. Thiopentone sodium is the ultra short acting barbiturate which is we use for the induction of anesthesia. Okay. Movement of drug from specific tissue like brain to the blood plasma is called redistribution. What is redistribution? It's a movement of drug back from specific tissue like brain to the blood plasma. It's called redistribution, and from plasma to the less vascularized organ like adipose tissue and muscle. That is called as the redistribution of drug, and that's why plasma concentration decreases. That's why plasma concentration of drug decreases, and drug will stored as a reservoir into the adipose tissue or to the fat. Now, example we have taken, that is the thiopentone. What is thiopentone? It's a ultra short acting barbiturate. It's a ultra short acting barbiturate which is used for the induction of general anesthesia. What is the route that is given? Intravenously. Thiopentone is given intravenously. What is the site of action? Site of action is the brain. When the thiopentone reaches from blood to the brain, that is called as distribution. Duration of action is 5-10 minutes and half-life is 5.5 to 26 hours. Okay, it's a half-life. Then why it is called as ultra short acting barbiturate? When the half-life is up to 26 hours, but still it is called as ultra short acting. Duration of action is just 5 to 10 minutes. Why is it so? Because it is highly lipid soluble drug. It is highly lipid soluble drug. Thiopentone sodium is a highly lipid soluble drug, and on IV administration, when it is given intravenously, it will immediately distributed to the brain. Why it is immediately distributed to the brain? Because site of action is the brain, and because of that it induces general anesthesia. After few minutes, what happens? Plasma concentration of thiopentone decreases. Plasma concentration of thiopentone decreases, and because of that withdrawal of thiopentone from the brain. Why plasma concentration of thiopentone decreases? Because withdrawal of thiopentone from the brain. Now that thiopentone from the brain, it goes to the plasma. That is called as redistribution. Thiopentone goes to the plasma. Redistribution of thiopentone to the plasma. Redistribution of thiopentone from plasma to the muscle and fat. And that's how the anesthetic action of thiopentone will terminated in 5 to 10 minutes. And this is called as the redistribution phenomenon. This is called as the redistribution phenomenon. Means initially drug will reach to the highly perfused organ like brain, and after that the drug is withdrawn from the specific tissue like brain to the plasma, and from plasma to the adipose tissue, and in the adipose tissue the drug will act as a temporary reservoir of a drug. And that's why the half-life of a drug is up to 26 hours, but the duration of action is very short. And for the induction of anesthesia, it is given as a loading dose. It is given as a loading dose, and for the maintenance of anesthesia, we give as a maintenance dose. Means for the thiopentone, the redistribution phenomena follows. Means first it goes to the brain, and then it goes to the plasma, and ultimately it will stored in the adipose tissue as a temporary reservoir of a drug, and that's why duration of action is very short but half-life is very long. So this is what is called as redistribution phenomenon of a drug, which is explained with the example of thiopentone sodium.